Well, welcome. We have a number of guests on the briefing today. I'm very honored to be joined by Vermont's Health Commissioner, Dr. Mark Levine, who just stepped away from the camera there, but we'll be back in a moment, I believe. We also have Mayor Christine Lott from the city of Winooski, and Emila Mrdanovic, and Emila is with USCRI, the refugee resettlement organization here in Vermont. And I believe we may be joined by others over the course of this briefing as well. Thank you all for being here this morning. And there, yes, we have Jacob Beaugray from AALV. And the reason we've assembled this whole team today is that we want to report out to the public an update on what was referred to as the Burlington Winooski outbreak when it began and spread in the early part of June. And we have some news about that outbreak. And we want to talk a little bit about the work that was involved in successfully containing the outbreak. And I will turn it over now to Dr. Levine to share the news and really update the public on where we're at with this outbreak. Welcome.
Thank you very much, Mayor. It's a pleasure to be here.
Yes, thank you for joining us. I think we've been doing these briefings for months. I think it's the first time we've teamed up with you on one. It's an honor to have you with us.
So we're here today to mark the formal end of the state's first significant outbreak and community spread of COVID-19. We consider an outbreak to be resolved following 2 full incubation periods, which for this virus is 28 total days with no new cases. Now, keep in mind, this isn't really a celebration. There were 117 of our neighbors, friends, family members who were affected by this virus in some way. Some got ill, several were hospitalized. And as we know, the pandemic is far from over. We continue to have new cases in Vermont each day, and we must continue to live our lives on a daily basis, recognizing that we must take precautions to prevent the spread of the virus. But nonetheless, even if we don't call it a celebration, it is a success story, and it's a good example and a precedent for managing outbreaks. And I hope Vermonters look to this to know that we are prepared and able to quickly respond to any new outbreaks. And while the term "we" is predominantly the Department of Health, it goes well beyond us alone. As the state's public health chief, at this time I want to recognize some of the people who quickly stepped up to contain this outbreak and protect the health of the people who live in our communities. Starting with the first community, Winooski, with Mayor Christine Lott, who I know is on the line as well, and Winooski City Manager Jesse Baker, and their team. And we have, of course, the mayor, Miro Weinberger from Burlington, Brian, and the rest of his team, who all contributed in innumerable ways to the management of this outbreak. Then we have the Associations of Africans living in Vermont, the U.S. Committee on Refugees and Immigrants, the school liaisons from the cities and district leadership, the Vermont Multilingual Task Force, the Department of Health's outbreak response and contact tracing teams. The list is literally endless. Critical to all of our efforts to contain this outbreak was the ability to have effective community engagement, to reach the populations where they are in culturally sensitive and linguistically appropriate ways. And for that, I cannot thank AALV and USCRI enough. Their incredible dedication and long hours were not just critical to reaching the people, but importantly, what we learned about delivering culturally and linguistically appropriate information is now a fundamental part of our ongoing outbreak response plans, and this information has been utilized a number of times since. For example, we recognize that a standard approach to messaging isn't fully effective, and that people with questions will often turn to their trusted community organizations, their informal or formal leaders, and cultural brokers. We will make sure that we connect early with these partners, ensure they have current and accessible information, and when appropriate, that they are paid for their time and expertise in assisting us. Because these are the things that make a difference. When we can reach people where they are, can help them to truly understand that there is no shame in having the virus or may have been exposed. That trust and access was crucial to our getting the information needed to do effective contact tracing, the key to containing an outbreak. Today, as I speak, many other states are becoming discouraged because of the challenges of engaging their populations in this critical activity of contact tracing. We did not have such problems in Vermont. One thing we know is that this pandemic continues and will continue to surprise us. We will continue to learn new lessons, and our lessons learned and best practices will be shared across Vermont state and municipal governments. And from this experience, we are all the more ready for whatever may come tomorrow. Thank you.
Thank you, Dr. Levine. Thank you for those thoughtful words and really fulsome description of this effort, and recognizing the many parties that that stepped up and played a role here. I want to echo your remarks about the importance and the role the community played, as well as the organizations on this call. This effort to trace and isolate and suppress ultimately the virus would not have been possible, would not have been successful without real sacrifice and efforts by the people of Burlington and the people of Winooski. We have a slide we wanted to pull up here. I think Olivia can pull it up, that kind of summarizes in some bullets here what you described, the way in which this outbreak was measured. A total of 117 people, as you noted, were tested positive, were infected during this outbreak, and appreciate your framing that people. This is not a celebration. We seek to avoid this number of infections, and everyone who was infected had their life significantly impacted. At the same time, if that many people were infected, there was a real chance of this spreading and becoming a substantially larger outbreak, having a substantially larger impact on the community. And that didn't happen. It's been 28 days now since the last infection. There are 2 hospitalizations. The median age of the people infected, and I will share this. All of this information is coming from the Department of Health, and we appreciate the transparency here and sharing this data. I think that bullet near the bottom there, 60% of the cases reported not having symptoms, really goes to the challenge of this virus, that so many people who have it and can spread it are not symptomatic. And thus the way that we contain it is through this box-it-in strategy of, when we do have a positive test, then quickly deploying additional tests. And you can see in the community from June 8th to August 4th, there was an enormous number of additional tests that were administered in Winooski and Burlington, almost 10,000 tests, individuals that were tested in that time period. And in addition to that testing strategy, of course, there's the contact tracing that Dr. Levine described, and then isolation and quarantine strategies as well, the other sort of 4 major box-it-in strategies. We're going to talk a little bit more about each of these elements of the work and how this came together. And I want to now invite Winooski Mayor Christine Lott to share her thoughts and reflections. Winooski was hit first by this outbreak and responded very robustly, and your leadership, Mayor, was very clear. Thank you for joining us to share your reflections.
Thank you, Mayor. And thank you to everyone on this call who's been a part of, supporting our communities through this outbreak. When this first started, I think something that was critical was starting daily calls with Vermont Department of Health, with folks from the cities of Winooski and Burlington. And we soon realized that we also needed to include our community partners, AALV, USCRI, because they are in our households working with residents directly, hearing what needs are, and we're able to really inform strategy and response. So I think early on, the materials that were being translated were still maybe not clear enough about who should isolate and how. And your organizations really helped address that and make things more accessible and more clear for our residents. That willingness to pivot our approach rapidly as needs were surfaced was critical. And the collaboration of many voices informing that, I think, is really key, and a really key learning here, that we need to have our community partners, the state, the local folks in the city, as many people as possible in constant contact and collaborating and getting very clear on what is happening on the ground. You all have caseworkers in direct contact with families here in Winooski, our school liaisons as well. And so hearing from people with that sort of connection is critically important. So we just had our last call this morning, actually, related to the outbreak. We have spent a lot of time across our cities and our organizations trying to support these efforts. Really appreciate the state and the Guard rapidly deploying and sustaining pop-up testing in both locations, input from Amila Thato on where those locations should be, times and when it could be most accessible to different residents, super important. And again, that ability to help us with outreach and making sure that we were getting the information to the people who need it. I also want to echo something Mayor Weinberger said about it is community members and residents as well who stepped up to actually isolate as needed, to wear masks and practice social distancing and support their neighbors to help us quickly sort of, I guess the phrase is box it in, but get a handle on the situation. We've also been able to, throughout the pandemic, maintain a weekly call of our various leaders in the community of Winooski. And so that's been another collaborative and channel for communication for us to be getting information out and receiving feedback as well. That's something that will continue. And I think seeing the learning that has taken place here, really proud of the work that all of you have done and being able to give direct feedback and being able to receive it and shift behaviors as needed to make sure that we are responding the best we can for residents. So thank you very much from the city of Winooski.
Thank you, Mayor. And just a last point about the pop-up testing that you referenced, maybe a last point, but an important point we haven't made yet is the important element of getting those sites set up quickly and operating quickly is coordination with property owners. And we do want to also thank, they're not joining us in the briefing today, but I think it should be noted, the Burlington Housing Authority and Champlain Housing Trust both were excellent partners in providing areas near where there had been infections for these sites to be set up and sustained, taking over large swaths of parking lots, other area for extended period of time as this testing was taking place. Both BHA and Champlain Housing Trust have really set up teams within their organizations to help with virus containment, and those teams really responded quickly and skillfully to help support these test sites, to help get the word out of people who should come in and take advantage of them. And they were key partners here as well. I wanted now to welcome Amila to take the floor, the Zoom floor here, and talk a little bit about what USCRI, the role that your organization played during this outbreak.
Thank you, Mayor, and thank you, Commissioner, for your remarks. They're heartfelt, and Mayor Lott for your remarks and your everyone's support throughout this process. Although, as the Commissioner mentioned, the pandemic is not over. Our work is not done. This is not a celebration. I think it is definitely a celebration of all of us coming together in partnership and supporting all of our community members, especially those who have limited language capacity and who traditionally are, face challenges in accessing information and services and programs. So USCRI and ALV since March have been working together. I really want to take a minute and recognize our staff, our case managers and other direct services staff who are on the ground, who have been on the ground, never stopped for a minute, working selflessly, sometimes until late hours in the night in supporting families, whether it's helping apply for unemployment benefits or accessing information about COVID-19 or testing or communicating with employers and landlords and various other supports that are needed and continue to be needed. So they're the unsung heroes that I want to recognize here, as well as our interpreters. Our two agencies both have professionally trained interpreters who speak the languages of refugee and immigrant communities in our state and who, played a critical role both in disseminating information about anything and everything COVID-19 related, as well as being on the ground at those pop-up testing sites and interpreting, providing face-to-face interpretation, which was critical, both in terms of making sure that all the health related information is translated, interpreted in the appropriate language, and also providing that comfort. As if you were tested, it's not the most fun experience. So I also want to echo what Mayor Lott said, and both mayors actually mentioned, and recognize the Department of Health for being open to thinking about their standard processes and then adopting and really being nimble and going to setting up testing sites in the communities where in places where the communities will have ease of access. And we very much appreciate that and being able to shift from site to site. I want to give a shout out to Multilingual Task Force for their work, the interpreters and the videographer who worked around the clock to put out videos and voice recordings in 14 different languages. We have a YouTube channel. There's 200 plus videos in 14 different languages with COVID-19 related information. And last but not least, the monetary support that was provided by both cities, the health department and the state refugee office was critical in enabling us to provide, food deliveries, care packages, and other essentials for the families. And I thank you on behalf of my staff and families. And our work is not done. As we, as a state, look at recovery efforts, refugees and immigrants will be a critical part of that. Thank you.
Thank you, Amila. And now we have two representatives from AALV with us. We have Jacob and Tato is also joined us, I see, and I'll turn it over to you to share some reflections on the role of AALV in containing this outbreak.
Thank you so much for inviting us. I want to echo what Commissioner Lavin, Mayor Weinberger, and Lot, as well as what Amila just said earlier, to say that this was a community effort. As an organization, we could not have done well if we didn't have the support of the communities we are serving, but also the state agencies and all the partners and volunteers we have and our interpreters we have in our community here. It has taken a lot of collaboration. Sometimes, despite the obvious frustration we had, we were all able to overcome our frustrations and work together and look at the common good and see how we can support our communities better. And I would say that our case managers and the communities we are working with have been critical in guiding us and reminding us that we are all in this together and we can do better if we are willing to listen and work together as a community. And this has been really helpful to us as an organization. And also seeing how we're able to come together quickly to support everyone's work, funding activities, like Amila said, with the resources that were put by both cities, Winooski and Burlington, and the Department of Health to support the effort that was done on the ground. And I hope this is something we can replicate and look at how we can do better so we are prepared for future events if this outbreak has to emerge again later down the road. And I want to also say again, thank you to our case managers for giving their time and putting enough, a lot of hours, weekends, and giving up on their family time to support the work that was done in the community. So I will let Tato continue if she wants to add a few more things.
Thank you, and thank you all for having us here. It is amazing how situations like this can get us together. And really, what an exemplary situation for all of us to recognize and learn that if we put our heads together and involve the people that we serve to drive our decision-making processes, it can all be a success. So that is to say, thank you all so much for the support, because we are all Vermonters at the end of the day. Mm. And we all want to be healthy. We all want to have equal access to healthcare, to everything else that's available for us as Vermonters, and work hard to make our community vibrant. So it all took our efforts. I want to really acknowledge the staff at VDH, the staff at Winooski City, as well as Burlington City. I'll give you an example. One night I was delivering food around 10 p.m. and I was chatting with a family that needed support in understanding isolation. And I could literally, in those moments, send a text message to someone at VDH and say, I need you to explain this scientific side and simplify it. That's how we worked throughout this pandemic. I was doing home visits with clients, and some at the beginning were confused about this idea of quarantining and staying a little longer in their homes. I could pick up the phone and call VDH and say, I need somebody to help me explain this phenomenon. People were available even after hours. I did not hesitate. We all did not hesitate to get in touch with each other, to help one another. And that's what really made this effort a success. So thank you to everybody who was just willing to work together. And we really look forward to continuing this work together, because it's not ending. We are here, and we are going to continue doing this successfully the way we have been doing. My dream is for other states to actually look at how we have done this successfully and ask us, how is it that you are able to succeed on this? And we can say, it all takes a village. Indeed, it takes a village to be successful in moments like this.
Thank you, Thato. And I think that's a good comment to kind of just shift towards maybe a final couple minutes together here, and then we will take some questions if there are any. One of the final pieces of collaboration of the organizations on this call and some others was to complete an after-action report to acknowledge, acknowledging the reality that we are months away, it appears, let's hope not too many months, but months away from there being widespread treatments or vaccines in place. So we're gonna be battling this virus for some time to come. And there were important lessons learned here that, as Commissioner Lean noted, has already, I think all of our organizations were changed by this experience, and I think other communities probably could benefit from the lessons that were learned here. Does anyone want to offer any kind of final thoughts from the after action report about the implications for the future that we experienced in this couple month period?
I'll share that. I think a key takeaway, again, this idea of taking a village and having all of these voices involved in decision making is something that we can really apply across the board in Vermont, not just with the pandemic and not even just with public health, but with all of the services that we are trying to provide to Vermonters, and making sure that those things that there is equal access even for folks who have different barriers like language. I'm really looking forward to seeing, a shift in that direction here.
Great. Thank you, Mayor.
I would like to add that information is definitely a powerful tool. And the ability to deliver information in a culturally appropriate manner that can be received and be applied to keep everyone safe was such a powerful thing for me to observe. And like Mayor Lott, I really look forward for us to work throughout this state to figure out how to make sure that we are all part of the puzzle. Vermont is a beautiful tapestry. We are not going back. We are from different countries. This is what makes our state beautiful. And as we continue to work together and figure out each other's culture and how we can bring this beauty together to make it a wonderful place to live, I think the more powerful it's going to be. So that was beautiful for me.
And I could just add a quick comment, a phrase and a principle. The phrase is cultural humility, which I think we all need to exercise and learn, and did learn. And the principle is knowledge is power. And if knowledge cannot be provided to others because there's something standing in the way, and often the standing in the way is a barrier that's built around culture and language. We need to learn how to work to overcome those barriers and to grow in response to that, so that everyone has the appropriate knowledge. Everyone can then be powerful in the exercise of that knowledge, and in this case, have their health be of direct benefit. But then that can also bring us all together in new ways where we can take the opportunity to learn from one another because we've overcome those barriers.
I would just add to both those last remarks, Burlington, I think as a city, has certainly come to understand that those lessons over the course of this pandemic. I feel fortunate that we had taken stock of what was going on in the pandemic over the course of March and April and the early part of May. And we had just announced, just before this outbreak began, a commitment to an 8-point plan to protect the most vulnerable and BIPOC communities. And we had set up a new program that we call Trusted Community Voices, where we actually have individuals from the various different ethnic communities, immigrant communities in Burlington that are now working for the city and helping us get the word out to these different communities within the city. And those trusted community voices were part of the outreach, working alongside AALV and USCRI. These new trusted community voices helped us get the word out. The fact that the city council joined the administration setting aside some resources early in this pandemic to respond to unexpected emergency situations like this, not money that could be deployed rapidly, is part of how Burlington was able to move quickly when this when some of the situations you've been hearing about today evolved. And we also have set up an outbreak team kind of based on the knowledge is power, and that information needs to be rapidly disseminated within the city government. There is now an outbreak team that helps us get information in and get it out. And so I think all of those elements are certainly on our minds as we think about going forward from here, and may have implications for others. I think trusted community voices will be part of Burlington city government permanently going forward beyond the pandemic. As Thados and Mayor Lott suggested, this is one of the ways I think it's not just rhetoric, but that we will be stronger as a community on the other side of this pandemic, as we've learned how to communicate better with each other and share with each other and get through challenges together. With that, why don't we will, Olivia, are there any members of the media that would have any questions?
There are. So first up is Liam Elder Connors from VPR. Liam, you should be able to enable your microphone now.
Hi. So talking about this, I guess, after action report that you have compiled, could you talk a little bit more specifically about maybe the deficiencies or sort of the issues that that Burlington, Winooski, and the state had that you are sort of have addressed now through this process? It sounds like there were maybe some issues at the beginning that were contributed potentially to the size of this outbreak, and it sounds like you've worked them out because some of it was communication. But I'm just kind of looking for specifically what were the deficiencies, and now what are the proposed things that you feel like that you've solved?
Anyone else like to do the first shot at that one?
Commissioner Levine, looks like you've got something.
Sure. So, I mean, one of the areas of concern to us was we thought we had many of our materials, educational materials, for the public in a sufficient range of languages to serve the populations that we have in Vermont. But we learned as a result of this situation that actually wasn't true, and we needed to broaden even further. We also learned a lot about the value, but also need for proper interpreter resources, and how expansive they needed to be, and how really timely they need to be. And I think that was an important lesson learned as well. We already knew a lot about how to partner and collaborate with other community organizations beyond and including municipal government, but some of the organizations that have been represented on this press conference here today. But you never know enough about that. So though we knew a lot and we're fairly adept at doing it, clearly we always benefit by even more interactions with our community partners and learn even new and better ways to work together. One of the issues that was raised during this conference today was the pop-up test sites and the locations of those, and how to be sensitive about where they are and make sure they're accessible to the population of concern. But that doesn't necessarily mean they have to be at the front door of that population, because you don't necessarily want to be calling out individuals by setting up a test site, in their living facility. It has to be very thoughtfully and deliberately planned. And I guess the last thing I would say is just that it does take a village, as was said, and I think that's very important. We had a little bit of criticism raised at one of the press conferences early on about some of the community not actually understanding what we tell Vermonters every day. Simple things, wash your hands a lot, physically distance, wear a mask. Some of those things really do require not just saying them over and over again, but saying them in, as we called it today, the very culturally appropriate and linguistically appropriate manner. And certainly making sure that every person who lives in Vermont, from whatever background they come from, can understand the priority messages of the day is really critical. So I think we've learned a lot about that from a communication standpoint as well.
I believe we learned some lessons about how to make the testing as convenient as possible for the community in a situation like this. Early on, there was some feedback that it was challenging for people who were working 9 to 5 to get to this test sites, because a lot of the hours early on, the bulk of the hours was during that time period. So to VDH's credit, the state changed up the hours and changed locations. That's why you saw such a variety of different locations that these sites were at. And a very variety of hours and different days to really make it more convenient for a large number of people, 10,000 people. Some of those may have been repeat tests, but 10,000 tests were administered, and part of the success of getting so many people tested was adding variety to locations and testing times. Anyone else want to share anything further in response to Liam?
Sure. I think, sorry, Mayor, one of the things that I think was a lesson learned for all of us is that our ability to plan together in how we are going to disseminate message, how we are going to approach different communities was such a critical lesson, that when we start the planning together versus, joining the bandwagon, it makes a huge difference. So, and I think moving forward is one of the things that we are committing, or we have committed to do, that we have to start planning for, communication, for translating materials, for messaging together as a team, and include the critical elements that if we are not together, we may miss and may have to redo the messaging, to repackage. So it's going to save us time. It's going to ensure that everyone gets the message at the same time.
And wondering a little bit too, Dr. Levine, as you mentioned, this pandemic is certainly not over. So thinking about moving forward, how are you going to ensure that something like this, or try to minimize the risk of something like this happening again within this community and within other sort of vulnerable communities and BIPOC communities in the area? I mean, this is certainly not going to be going away. So what are some things that you're going to be doing to try to minimize the risk in the future?
Yeah, and I think that has to do with making sure that we do have the proper attention paid to our ability to communicate in all languages, in all dialects, the basic messaging that we try to hammer home every day to Vermonters across the spectrum of backgrounds. And that work has already, gone leaps and bounds in terms of having that foundation of communication available. I think that's really, really important. Obviously, and I know you don't mean your question in this way, but one thing we are very sensitive to in the Department of Health is issues of stigma. And we often think of stigma with things like, oh, somebody drinks too much or they overdosed from heroin or fentanyl. But there's also, we've learned, not just in this example, but I mean, we learned this through time immemorial about the power of infections to create stigma, actually. And here we are dealing with a novel virus that the human race has never seen before, and we can't be having any population put in the position of having fingers pointed at them because they contracted a virus. This could happen to any of us. And indeed, when you look at our Vermont statistics, it has happened to any of us. It doesn't matter what our race, our gender, our age, our background is. Some are more vulnerable than others, but all are vulnerable to this novel virus. So again, our efforts have always been, protecting private information and privileged information, but at the same time, that extends to communities and populations as well to the best of our ability, making sure that when an outbreak occurs, and inevitably when they do occur, everyone learns about them, whether we told them or nobody told them, but making sure we do our most to educate the community at large that it's the air we breathe and it's the virus's problem. It's not the human beings who ended up being susceptible and coming down with an infection from the virus or who may have unwittingly spread it to others. So just avoiding that potential to splinter communities or anyone in the state because of the fact that an outbreak has occurred in one place or another. Could occur anywhere.
Thank you.
So there's actually something really tactical that I want to make sure we highlight, and that's that not everybody has the ability to isolate or self-quarantine given their living situation. So I think one thing that was really important is asking right up front if people are able to do that, if they need to be connected with support for rent because they're missing work, or if they need to have food delivered to them to make sure that they're still able to eat. We have larger families that are living in 2-bedroom apartments because that is kind of the stock around here. And so how are they going to isolate in an apartment with 1 bathroom that they're sharing with their family? They might need supported isolation outside of the home. So I think that's something that has to be asked at the outset if you've identified a positive case to make sure that person is able to follow those rules.
Thank you so much for bringing that up. And I know the mayor is going to want to weigh in on that for sure, because it's a special interest of his. But as a health department official, that has been so well integrated into, if you will, our script. When we are dealing with a new case or doing contact tracing. And it's not only identifying, do they have the place to be in where they can be safest themselves and keep their loved ones safe, but it's also what do they require in terms of essential services. And that's where our State Emergency Operations Center comes in, because there's a direct connection between the answers to these questions and how impactful we can be in serving our fellow citizens. Mayor?
Well, I do want to. I think that change in the script. My understanding that was specific feedback from AALV and USCRI about how the script could be changed to make sure that the communities impacted understood the resources available to them, understood the risks, and I thought that was a really granular, critical way in which this multi-agency response really kind of changed the outcome. I do think a role for municipalities to play, and that we did play in this outbreak, is to help with those quarantining efforts. To help, quarantining is challenging. To properly quarantine, people don't leave the property for an extended period of time. And it is because of that we conceived of this idea of having, we didn't conceive of it. We heard from public health experts around the country, but there aren't too many municipalities that actually took the next step and really tried to set up a supportive quarantine initiative. Both Winooski and Burlington in this outbreak really helped get some of those basic supplies to the residents of our city. This is something we're trying to codify and have in place for Burlington going forward, these supportive quarantine services for anyone who needs it, who is told by the state at some point or by these contact tracers that they really are ordered to quarantine. We hope one of their next calls is to the city of Burlington if they do need help with that and help with achieving that. And this is something we had in place for the return of students at the beginning of June as well. I just want to go back a little bit to Liam's question and just make a point about the framing of that question. I take, Liam, the point. I think we are, we do think, and I think the way you said it is, in future outbreaks that there be fewer people impacted. That's certainly the goal. And I think certainly some of the lessons learned here could accomplish that goal in the future. It is not the goal. It's not a realistic goal, and it's not the way we're operating. I want to be clear. There will be more infections. There are some new infections every day in the state, even almost every day. So some days we have zero, but the virus is circulating. And we are, as a matter of policy, the state and the municipalities think it's right for us to have sort of turned back on various sectors of the economy and the community. The key to the success going forward is to respond rapidly when new infections do occur and to keep those contained. And I do just want to share, if anyone watching hasn't looked recently at the city's dashboard here, you can really see the story of how this outbreak played out. Here, it really began in early June, and you see which my cursor's around the beginning of June here. You see a big spike in the number of infections. Much of that related to this outbreak, not 100% of that, but a lot of it related to this outbreak. But then you see it very quickly contained and go back down to a much lower level. We have small, modest spikes at other times in Chittenden County over the course of July, but the 7-day average has stayed at that for the most part in this period at 5 or less. And in recent weeks, it's gotten even better. It's down to really a couple a day. So the point here, I don't think is, well, I think we do hope we've all learned from this and future outbreaks will be smaller. I think in many ways, what we're describing here, I think probably should be thought of as not something to be avoided, but this is what a good community response looks like in the kind of box it in period of the virus suppression effort that we're under now. And this is how we're going to get through this pandemic, is when there are outbreaks, responding quickly and keeping it contained. And that's the goal from my perspective going forward from here. Back to you, Olivia. Are there other questions?
I don't believe so. I've had a few other I guess I'll say if any other members of the media are on the line and want to ask a question, please just send me an email and then I will enable your microphone. Mayor, I don't know if the reporter who's in person has a question, and then I know we have one other topic we wanted to get to quickly, so we could let the full group go and give one other update as well.
Very good. If there's nothing else from, I do see some members of the media on the line, but if there's no further questions, we will say thank you again to Dr. Levine, Mayor Lott, our guests, other guests. It's been a privilege working with you, and we onward from here. We will be in touch, we know, in the days ahead. So thank you all.
Thank you.
Thank you.
I believe also, and I see him now, Zach Williamson, a frequent participant in these briefings, and Brian Lowe, our Chief Innovation Officer and leader in the city's virus response, are both with us. And I think you are back to give another update on Plant for the People.
Yes, this is a Plant for the People update. A couple good things to share. It's an exciting program where we are definitely grateful to the hundreds of gardeners who are participating, which is really just a wonderful thing, and grateful for all the fruits and vegetables that people have donated from Burlington and beyond. Things are going quite well. The big news on our front is that the hospital, the UVM Medical Center, has also joined. They did a seedling distribution last week, and they are a huge employer in the state. So their participation helps kind of expand the reach of this concept and idea, hopefully for the benefit of multiple food shelves, both feeding Chittenden and beyond. Zach is going to speak a little bit about our next plant distribution, because it is August, but in Vermont, you can plant a second round. And so we really want to encourage people to do that. He'll share the details of when and where, but we think it's a really important thing this year that we encourage as many people as we can to get out there and plant a second round, both because we're going to need that food as we go into the late summer and fall from a collection perspective for the food shelf, but also because it's good for your family's food security to have a second round of crops going here in Vermont. And all the plants that we distribute are plants that perform well kind of in a late summer or fall in Vermont. So a lot of cauliflower, cabbage, spinach, kale, broccoli, things like that. Zach, do you want to speak to some of the locations and times?
Sure, definitely. So yeah, as Brian said, we're doing this, our last of 3 plant distributions. It's this Friday, August 14th. We're going to have over 2,000 plants to give away, and we're working really closely with Red Wagon Plants. They've been a great partner in this initiative. So we will be located this Friday, starting at 4:30 and running until 6 o'clock. We'll be at 405 Pine Street, the BCA studios on Pine Street. Will be at the parking lot of the One Community Center. So One Community Center's official address is on Allen Street. We'll be on the North Street facing side. It's about 201 North Street if you Google map it. But we'll be in their parking lot in the old North End. So that's the One Community Center. And then we'll be out in the new North End once again at Bibbins Ace Hardware in the Ethan Allen Shopping Plaza. They've also been a great partner and very generous in letting us use their storefront area to set up a table and distribute these plants. So anyone can come, whether you are an avid gardener or want to give this a shot. It's another chance to put something in the ground and see it grow. And all these plants are free, and you can generally take, a good 2 to 3, sometimes more plants, depending on what you're doing and what your needs are. But we have a lot of plants to give away, and we don't want them back. So we want them to go to you guys, and we want them to get in the ground. And ideally that produce comes back to us, but if you can use it yourself, that's fine too. It's all part of the program.
Excellent. Zach, so did you say what are the seedlings that people can plant now and still harvest out before the snow flies here?
The official list, although it ends with an and more from Red Wagon, but they said broccoli, cabbage, lettuce, chard, cauliflower, kale, scallions, and mustard greens, and then possibly some other things.
And I think you might be able to get away with carrots, peas, and beets too, although some of that could be debatable. But
excellent. All right. So again, to summarize, down on Pine Street, the BCA building, and the hours again on Friday are, Zach?
They are from 4:30 to 6 p.m.
4:30 to 6 p.m. And on the other side, what we're still taking, we've started harvesting as well, right? Well, you want to give an update on? I know we hit a milestone there as well.
You want to do that, Brian?
Well,
Yeah, go for it.
I'm happy to answer that. I think I may have been overambitious in my 100,000 pound goal. We did hit a good milestone recently. And just to clarify, the plant distributions will be both at 405 Pine Street in the south end, also at Bivens Ace Hardware in the new north end, and at the St. Joe's Community Center on the parking lot that abuts North Street in the old north end. So we're trying to make it as easy as possible for folks to grab plants. We are across the 2,000 pound mark, which is great. That is probably closer to 100,000 vegetable servings. It's not going to be 100,000 pounds, most likely. I think that was a little bit of an enthusiastic goal on my part. But I think it's really been wonderful to see. And we've had people drop off, an extra zucchini from their garden, or some people who have given us, literally 20 or 30 pounds at a time of produce from their garden. So it's all needed. It all goes to good cause. And I think with the hospital's participation, perhaps we'll get even higher. It's great that they've joined in as well.
And I'll just remind people the times that we do that. So yeah, we've been doing this all summer, started in June, and we'll be doing this through the fall to get the plants that we're giving away on Friday, hopefully. But we are Tuesdays, we're at the Intervale Center, and this is always from 9:30 in the morning until noon. So we're at the Intervale Center on Tuesdays. We're at the Champlain Elementary School on Pine Street from 9:30 to noon on Thursdays. And then our final Saturday collection is not this Saturday, but next Saturday, August 22nd, will be again at 405 Pine Street in conjunction with the farmers market from 9:30 to noon also. So those collections are really a great time, and it's really a cool experience to see people bring their hard work and donate it. I'm always like, you're really giving us these tomatoes? These are gorgeous, but it's amazing. So thank you to all those gardeners and our great volunteers who are there as well. We have a great group of volunteers who show up every week to help us in these collections. It's really great.
All right, excellent. Thank you both for coming on. And while you stick around, we'll just check in again. Is there anyone who has any further questions before we break up here, Olivia?
Alyssa, who's here in person, does have some questions.
Okay, great.
I believe they are on separate topics. So we could, since we're over time, we could close the briefing, let everyone else go, and do that as a separate interview, or we could keep going.
Why don't we do that if there's nothing else online? I've got, yes, Alyssa here in the office, and I'll turn my attention there in a moment. But thank you, everyone, for tuning in. We will planning on having another briefing next Wednesday. We'll do something sooner if needed. And thank you all for joining us. Thanks again, Brian and Zach, and to all of our earlier guests. Thank you, Olivia, for all your work. And I'm sure it's clear to regular viewers of this event that Olivia plays a huge role in pulling these events together. These are not easy logistical affairs to keep so many people coordinated. And thank you, Olivia, for another thorough briefing and all your service on this. So thanks, everyone. We will see you soon.